Hello, Dr. Richard Harris here, and welcome to our YouTube channel. We present CBD Journal Club. This is a monthly review of a recent article outlining something with CBD, and this video is brought to you by CBD Health Collection. CBD Health Collection is the CBD that we actually use in the household, and by we, I mean everyone, myself, my dog, and my wife. And you can find a link to CBD Health Collection and all of their wonderful products in the notes. Let's dive into this month's study. This study is titled Effects of Cannabidiol CBD on Exercise Physiology and Bioenergetics, a randomized controlled pilot trial. And there will be a link to the trial in the notes if you want to look at yourself. This was a pretty technical trial, so I'm going to try and do this at a very high level and not mention all the numbers, because if I did that, my head would explode because there's a lot of numbers. But let's dive into the background. CBD in clinical trials typically shows an effect for conditions studied in the range of 300 to 1500 milligrams. And this is for treating medical conditions. Now, what I'm not saying is that CBD is not effective at lower doses for things that are part of general wellness or maintenance. In fact, that's why I use it. I'm not using it to treat a medical condition. I'm just using it for general wellness. Acute doses of up to 6,000 milligrams. Don't go and take 6,000 milligrams of CBD or even 300 or 1500 without talking to your physician first. I cannot emphasize that enough. But doses up to 6,000 in clinical studies for certain conditions appear to be safe. Only side effects were not diarrhea, nausea, and headache. CBD was recently removed from the World Anti-Doping Agency's list. And in the UK, where this study was done, CBD is being used by more athletes than ever. About 26% of rugby players in one study used CBD. And that percentage was even higher in those among over 28 years old. I guess that's the geriatric population for rugby players. It was 39%. And when asked why they use CBD, 80% said it was to enhance recovery. That's actually why I started taking CBD. Back when I was a power lifter, I was trying to get to a 600-pound deadlift, and I wanted to enhance my recovery and my sleep time. And that's why I started taking CBD. 78% to improve sleep, 32% to reduce anxiety, and 14% actually for concussions. And I believe we've talked about this before, but CBD is being studied in a lot of these brain conditions as a way to protect brain health. Only 2 randomized controlled trials have been done on CBD and athletes. The first found no effect of 150 milligrams daily for 3 days on non-invasive measures of muscle damage following eccentric exercise. The second found 60 milligrams of CBD decreased concentrations of CK and myoglobin. CK and myoglobin are both things that are present inside the muscle, and we can use these as markers of muscle inflammation post-workout. And CBD in this other study was found to increase 1-rep back squat performance at 72 hours, but not 24 or 48 hours following exercise. So this study was a randomized, placebo-controlled, exploratory study, and it was mainly to investigate the effects of acute oral CBD on physiological and psychological responses to submaximal and exhaustive running exercise and endurance trained athletes. This was basically to see if there's enough smoke to do a larger clinical trial. If there's smoke, there's fire, right? So this is a pilot study not designed to test for effect. So this wasn't a randomized controlled trial to test for cause and effect. This is one to see if there's enough in this study to warrant a larger, more well thought out, well done study. And it was done to gain preliminary understanding of CBD's effects on exercise physiology and see if a larger trial is warranted. So in the methods, how did they do this study? Participants had 2 treatment sessions involving 400 milligrams of CBD or placebo in a double-blind crossover design. Sessions were separated by at least 7 days. I'm sorry, I think they got 300 milligrams of CBD, not 400. Sessions were separated by at least 7-day washout period, as this dose of CBD is reported to have a half-life of around 24 hours. People were randomized 1-to-1 to treatment, so some of them got the CBD first, others got the placebo first, and then they went 7 days, and then they got the opposite. CBD was suspended in MCT oil. It only contains CBD, no other cannabinoids. And the study was healthy males between 18 and 45 with no previous cannabinoid use within 3 months. And they wanted people who were endurance trained. So they ran an average of 40 kilometers per week. Participants did a treadmill test to look for maximum oxygen consumption, what we call VO2 max. And this is basically a surrogate measure for cardiovascular fitness and aerobic endurance. And participants were told to abstain from alcohol 24 hours before, caffeine 12 hours before, avoid exercise for 24 hours before, anti-inflammatory meds 24 hours before, and keep a diet record 24 hours before. They ate a standardized prepackaged meal in the evening, fasted overnight, and then they wanted to spend at least 8 hours in bed and collect a morning urine sample. We'll talk about that more in a minute. And they were advised to consume 500 mils of water before coming to the lab. Participants arrived at the lab at 8:30 in the morning. A drug test was done to make sure they were cannabinoid free. They also wanted to check to make sure they weren't dehydrated, so they used something called specific gravity. That's a way of telling basically how much stuff is in the urine. And if you have a more dilute urine, that means they're less likely to be dehydrated versus you have a very concentrated urine. That means your body is really trying to retain water and then you're dehydrated. It's a test that we do all the time in the office. And if I see people with a high specific gravity, I always tell them, you need more water, you need more electrolytes. Each session involved a baseline assessment, a pre-run assessment, and that happened 60 to 90 minutes after treatment. And then they had a run one, which was 90 to 150 minutes post-ingestion. They had a post-run one assessment, which was 155 to 170 minutes after the ingestion. Then they had run two, which was 180 to 200 minutes post-ingestion. And then they had a run two post-assessment, 205 to 220 minutes. And then a 1 hour post-run two assessment, which was on average 220 to 260 minutes after the ingestion of the CBD. At baseline, a test included blood pressure, heart rate. They used an anxiety questionnaire called the State Trait Anxiety Inventory and a mood questionnaire called PALMS. They also wanted to check for GI discomfort, since the prevalent adverse effect that happens in clinical studies with CBD is GI effects. So they wanted to see if people were having those while they were doing these exercise regimens. Breakfast was standardized to raisin toast and 30 grams of raspberry jam, 20 grams of margarine, and 500 mils of water. Doesn't seem like a very exciting breakfast at all. And in fact, I would have done something a little bit differently with the breakfast. We'll talk about that later. Treatment was given after breakfast with a high-strength mint to hide flavor. No water was given during exercise, but people could take 500 mils of water on completion of run one and run two. So that post-run one, post-run two phase. And at the end, participants took an adverse event checklist. Run one was designed to get participants to run at 60 minutes at a fixed speed, designed to elicit 70% of their VO2 max. They measured respiratory gases at 24, 37, 50 minutes for 8 minutes, and they looked at heart rate. They also asked ratings of perceived exertion, or RPE. They also checked blood lactate, blood glucose. That was done at 20, 40, and 60 minutes. Run two was a fixed speed with an increasing gradient, so like an incline that was increasing by 2% every 3 minutes until exhaustion. And no feedback on the time they were spent in run two or the duration of exercise. They took respiratory gases during the final 5 minutes of exercise when the heart rate exceeded 90% of the heart rate maximum, and they measured time to exhaustion and the max heart rate. Body weight was measured pre and post run one, post run two to estimate sweat loss. Blood pressure was measured at baseline, pre and post run one, run two, and 1 hour post run two. GI discomfort was measured at baseline, pre and post run one, post run two, 1 hour post run two as well. And they used a visual analog scale. We talked about subjective feelings were measured using the STAS and the PALMS, and blood was done at baseline, post each run, and then 1 hour post run two. They measured cannabinoids, they measured metabolites, they measured THC. They also looked at specific cytokines. We've talked about cytokines before. They're inflammatory mediators on the podcast. They looked at IL-1, TNF. They also looked at IL-6, myoglobin, CK, and LPS. We've talked about LPS lipopolysaccharides. These are parts of certain bacteria in our gut, and if they're released in the bloodstream after exercise, that's one way you can tell that there's some exercise damage going on to the gut or exercise inflammation in the gut, which is not necessarily a bad thing. You want inflammation after you work out to a certain degree. You don't want it too high, but you want inflammation, signaling that the muscles are under work, and that will bring nutrients and blood flow to the muscles. They also measured sleep and muscle soreness as well. Now, we mentioned at the beginning, this study was not powered to assess effect. So this is not a cause and effect study. Rather, this was a preliminary study to see if CBD had any effect on exercise physiology. It was not what we call a investigational study. It was a pilot study looking to see if this is worthy of a more in-depth investigation. Now, in the results, baseline body weight, specific gravity, temperature, lab temp, and humidity was similar across all sessions. All 5 participants who completed the CBD portion before placebo had low levels of CBD metabolite. We've talked about this before, 7-CoH CBD, and low levels of CBD. And that is significant. We'll talk about that in a minute, because when the CBD people went to the placebo group, they still had some CBD in their concentrate in their blood, and no THC was detected. They also measured plasma anandamide. Anandamide is a natural endocannabinoid, and we've talked about on this channel before how CBD works is by blocking the metabolism of anandamide. So what they found was plasma anandamide concentrations were lower pre-run 1 compared to baseline, and higher post-run 1, post-run 2, and 1 hour post-run 2 compared to baseline. We'll talk about why that is in a minute. Suboptimal exercise, the effects of CBD on RPE, that rating perceived exertion, the respiratory exchange ratio, which is a way that we can look at, are you burning fat or are you burning carbohydrates mainly? The respiratory rate and fluid loss was uncertain, so they weren't able to ascertain if there was a difference because of the low power in the study. Blood lactate at 40 minutes, VO2 at 37, and ratings of pleasure on the feeling scale at 20 and 40 minutes were all higher with CBD, but the effects overlap between CBD and placebo, meaning the CBD group saw it trended towards these things being higher, but if you looked at the range, the range, there was some overlap. At run 2, effects of CBD on heart rate max, total time exercising, TTE, blood lactate, and blood glucose, respiratory rate were uncertain. VO2 max, the respiratory ratio max appeared elevated with CBD. However, again, the range there's overlap. So it was that CBD had if the placebo is here, CBD was here, but there's some overlap there. Serum markers, higher serum IL-6 and MB, the myoglobin, post-run 1, post-run 2, and 1 hour post-run 2 compared to baseline. And all participants, that's what you'd expect to see, higher inflammatory markers and evidence of muscle inflammation. LPS concentration was higher post-run 1, post-run 2 compared to baseline. That's also what you'd expect to see. And then you saw higher TNF alpha as well in all of those groups. That's expected in people and everyone there because of the inflammation associated with exercise. But it's not bad inflammation if exercise is done appropriately. If you exercise for 3 hours every day, that inflammation can turn bad. But exercise is a good stressor. Again, not all inflammation is bad inflammation. If you haven't checked out our inflammation podcast, we talk about that. CBD. In the CBD group, IL-1 concentrations decreased post-run 2, 1 hour post-run 2, and myoglobin concentrations possibly increased. It was very narrow there, very small increase. GI distress was so low that there was really no difference between the groups. Fatigue appeared reduced post-run 1, possibly elevated 1 hour post-run 2 with CBD. Heart rate reduced with CBD pre-run 1, but this effect seemed to be present at baseline. And then the effect of muscle soreness and sleep quality was uncertain. They weren't able to tell with this study. Most participants believed that CBD would have a slightly positive effect on performance. One believed it would have a slightly negative effect. Only one of the 9 participants guessed correctly which session they received CBD. 3 guessed which they received a placebo correctly, and there were no adverse events. Why does that matter? Because of the placebo effect, right? If you believe that something is going to have an effect, it's more likely to have some type of effect. We know that, in fact, over a wide range of studies, the most consistent and powerful effect on a whole host of conditions is placebo. So many different studies have shown that for no matter what you're studying, if it's a placebo-controlled trial, the placebo usually has some effect. So that's important to ascertain these types of things. In the discussion, the results suggested CBD may alter several key parameters, including submaximal VO2, maximal VO2, feelings of pleasure doing submaximal exercise, and markers of exercise-induced inflammation. However, as we've mentioned so many times before, these results are subjective to what we call a type 1 error, or identifying a false positive. So these results must be taken with a grain of salt. They can only be interpreted, literally, only be interpreted to say there is some effect here that warrants a much deeper investigation. CBD appeared to increase VO2 during 60 minutes submaximal exercise, and this may indicate a reduction in running economy and therefore actually detrimental effects on exercise performance. However, this was very subtle compared to other interventions like ketogenic nutrition plan. In fact, the difference was only about 2.3% increase in energy expenditure. So there was more energy expended in the CBD group that they saw in this study. There was no increase in heart rate or RPE, nor decrease in TTE, which you would expect with a decrease in performance. So these other markers of performance weren't really implicated. Authors suggest any detrimental effect on running economy likely small and not likely to impact performance. Authors also suggest alteration in breathing patterns is not the cause, and this is unlikely to be effective changing running patterns on a treadmill. One possible explanation for this is that it increased VO2 is that CBD increased tissue blood flow. And preclinical studies show that CBD can cause vasodilation in the arteries of rats and humans. A small clinical trial showed 600 milligrams of CBD reduced blood pressure by about 6 and peripheral resistance during hand grip. Peripheral resistance is basically the total resistance of the vessels in your body. And reducing that means that there's easier flow, and that's typically a sign of vasodilation or larger arteries. And this would explain why an increase in oxygen consumption was not accompanied by an increase in heart rate, RPE, or a decrease in TTE. However, blood pressure was not affected. So really, there's still some mechanism here that needs to be elucidated. CBD appeared to improve affect during the first 50 minutes of exercise. There's no difference at 60. But ratings at 60 could be influenced knowing that the exercise was about to end. Typically, people are happier when their exercise is about to end. So you usually see a increase in affect towards the end of treatment. There's no effect on PALMS or the STACI screening test, likely because all participants reported low scores on this. So low scores on these mood and anxiety measures. The authors say that CBD may affect pain perception and thereby increases feelings of pleasure during exercise, and CBD works on several receptors in mood signaling. This might be why there was a more trend towards more positive affect for those who were in the CBD group. Exercise increased several markers of inflammation. That's as to be expected. Muscle damage and GI damage. CBD suppressed IL-1. However, post-workout IL concentrations were still very low. So this is not saying inflammation went rampant. It's saying it went up, which is supposed to happen, but it wasn't like you would see with an autoimmune disease or an acute infection or anything like that. IL-6 and TNF-alpha were not affected. CBD appeared to increase myoglobin concentrations 1 hour post-run 1, increased muscle damage. There was a small increase in TTE on CBD treatment. So this is what this is saying is basically you had an increase in this myoglobin post-exercise, but this is most likely because there was a small increase in the total time exercising in CBD treatment group. But that still needs to be studied further in a further study. CBD did not seem to impact the LPS release from the gut. Now, we talked about that effect on anandamide decreasing from baseline to pre-run 1 and then increasing from pre-run 1 to post-run 1, regardless of treatment. And this was likely due to eating. Eating lowers anandamide. Submaximal exercises increases anandamide. And CBD also appeared to decrease anandamide post-run 2 relative to placebo. Again, that's something that's going to have to be elucidated in a further study. I'm sure you're probably tired of me saying that. There was another study that showed the opposite effect with chronic CBD on anandamide concentrations, which is typically what you'd expect. Typically, you'd expect anandamide to go up with CBD chronic administration because the CBD is going to work by binding and taking up space on the fatty acid hydrolase, which degrades anandamide in our body's natural endocannabinoids. Limitations of this study: it's a pilot study. Again, these results do not show effect. It was only males because they didn't want the changes in the menstrual cycle. There's changes in metabolism that happen then. They didn't want that to throw off the results. The participants had CBD and CBD metabolites in their blood if they got the CBD first. So you may need a longer washout period. Plus, the plasma concentrations were relatively low during the initial run, and you may need to delay the start to capture when the CBD is actually highest in the blood. Another thing is this CBD dose is higher than what most people would use for CBD. Most people are using somewhere between 10 to 50 milligrams a day for just general wellness purposes, not using what doses we found in medical trials for disease states. Another thing I think they could have done is the meal that they gave them before. We know that CBD is fat soluble. Multiple studies have shown that CBD absorption is increased with fat. So using a high fat meal instead of more of a carbohydrate based meal could have enhanced the absorption of CBD. So takeaway from this study, it's interesting to see that CBD is being studied for athletic performance, athletic recovery. I think you're going to see more studies in this as CBD becomes more popular. And of course, we will bring you those results here at CBD Journal Club. We want to thank our sponsor, CBD Health Collection, for this video. We'll be back next month with another CBD related article. Thank you and have a blessed day.